You eat food, sugar from your food, glucose, hits your bloodstream. A hormone called insulin should act like a key, opening tiny doors on your cells so glucose can get in and power you up. With diabetes, that system breaks, either you don't have enough keys, or the doors stop listening. What is diabetes? Hey, welcome to BioLogix. In this video, we'll cover what diabetes actually is, the main types, symptoms, complications, and what treatment and prevention look like. According to National Institute of Diabetes and Digestive and Kidney Diseases, diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. That means your blood glucose level is higher than normal. Let's now discuss the types of diabetes. The most common types of diabetes are type 1, type 2, and gestational diabetes. We will mainly talk about type 2 diabetes in this video, as it is one of the most common types of diabetes. What is type 2 diabetes? Type 2 diabetes, the most common form, happens when blood glucose, blood sugar, stays too high. Glucose is your main fuel and mostly comes from food. Insulin, a hormone from the pancreas, helps move glucose into your cells for energy. In type 2 diabetes, the body doesn't make enough insulin or doesn't use it well, so too much glucose remains in the blood and not enough enters the cells. Do you know how insulin normally works and what insulin resistance is? Let's find out. When you eat, blood glucose rises. In response, the pancreas releases a hormone called insulin. Insulin binds to receptors on cells. The cell moves GLUT4 transporters to the cell surface, like sliding more doors into place, so glucose can enter and be burned for energy or stored. Insulin resistance is when your cells don't respond properly to insulin. Insulin resistance can lead to higher blood sugar and make weight gain more likely. In insulin resistance, the receptor doesn't respond well to the insulin, so fewer doors open, less sugar enters cells, more stays in the blood, and over time that high blood sugar is harmful. What are the symptoms and causes of type 2 diabetes? Untreated high sugars can cause thirst, frequent urination, blurry vision, fatigue, slow healing wounds, and unexplained weight loss. Some people notice numbness or tingling in feet. But here's the tricky part. Many people, especially with type 2, have no obvious symptoms for years. The exact causes of reduced insulin production and insulin resistance in type 2 diabetes aren't fully known. Still, some people are more likely to develop it due to specific risk factors. Risk is higher if you have overweight, obesity, or a large waist, are 35 plus, have a family history, are African American, American Indian, Alaska Native, Asian American, Hispanic, Latino, or Pacific Islander, are physically inactive, sedentary job or mobility limits, smoke or are exposed to secondhand smoke, including e-cigarettes, have prediabetes, or had gestational diabetes. Children and teens can develop type 2 diabetes too, but risk rises with age. Why high glucose is a problem? Following a good diabetes care plan helps protect you from many complications of diabetes. However, if not managed, diabetes increases the risk of damage to the eyes, kidneys, nerves, and heart. It also raises the risk of foot problems, gum disease, and other dental issues, and is linked to certain cancers. Let's discuss about treatment of type 2 diabetes. Some people with type 2 diabetes can manage their blood sugar through lifestyle changes, balanced nutrition, regular physical activity, adequate sleep, stress management, and not smoking. Many people with type 2 diabetes also need medication, including pills and injections such as insulin. Over time, more than one medicine may be needed to control blood sugar. Consult your doctor for the right advice. How can you prevent type 2 diabetes? People at high risk for type 2 diabetes can often delay or prevent it with a structured lifestyle program. The goal is modest weight loss, about 5 to 7% of body weight, and regular physical activity, at least 150 minutes per week of moderate exercise. In large studies, this approach cut the risk of developing diabetes by roughly half, and by even more in older adults. Living well with diabetes. Diabetes care takes time. Build small, steady habits, eat more fiber, move regularly, and get enough sleep. Keep up with eye and kidney checks and foot care, and aim for heart-healthy numbers. Remember, progress over perfection. If this helped, please like and share it with someone who might benefit.